Welcome to Converge to Accelerate, affectionately known as ConV2X, to draw the blueprint for a new digital health era. Thank you for joining us today. My name is Tori Sinai, curator of ConV2X and founder and publisher of Partners in Digital Health Portfolio, publishing the emerging market open access peer-reviewed journals Blockchain in Healthcare Today and Telehealth in Medicine Today. We're here today to accelerate healthcare modernization, efficiency, and interoperability. This doesn't come without sacrifice, an aversion to change, and the necessity to reach across global, cultural, geographic, and economic divides. We continue to grapple with beating down a worldwide pandemic and the myriad of issues it's presented to world leaders charged with ensuring good health prosperity for citizens. In early September, President Xi Jinping called for China to achieve common prosperity, a vision that seeks to narrow the wealth gap between urban and rural communities. The concept is one that now places China alongside nations where equity has become an international thematic economic byproduct of COVID-19. It now joins all nations in the quest for equity. Welcome to the team. I propose health equity be included in this pursuit to eliminate inequality between urban and rural areas, to strengthen social stability and make quality healthcare safely accessible for all, to truly make solid progress towards a global common prosperity. The endeavor will require policymakers to drive policy changes for the good of citizens and address tax regulation, the tech sector and ethics, healthcare fraud, counterfeit drugs, transparency, minimum standards for connectivity, cybersecurity, curtail health costs certainly, lower drug costs, increase digital literacy, education reform, and improve public service to provide a social safety net. It is clear visionary leadership can design policies that create opportunities for equity, innovation, and scientific truth. These elements can bridge divides to provide the best care through common priorities, crossing cultural and geographic barriers. Holding diversity in esteem is one way to achieve this objective. Enhancing bibliodiversity in the scientific community to include services and platforms, funding mechanisms, and introducing new evaluation measures for researchers will allow research communications to include different languages, publication outputs, research topics, and develop new fields of study that support the needs of pluralism across different research communities. In addition, diversity may reduce monopoly, disrupt monoculture, and the exorbitant prices required to publish innovative research in first-tier legacy journals. In my experience, to bring a new journal to the market, you need two things: a unique raison d'etre, that is not a Me Too journal. And as publisher, I ask myself, what does the journal bring to the community beyond readership, citations, credibility, conformity? This is for member organizations, enhancing the author's reputation, research, and validity of content. Because PDH, Partners in Digital Health, is a boutique publishing company and not a behemoth monopolizing monoculture and high prices, we remain hands-on with the community, highly customer-focused, work with you, advise, and consult. Nothing goes into a black hole for months and years. I'm happy to report authors have pulled submissions from other journals and have submitted them to ours because we're present, responsive, and have a reputation of operating with integrity and are appreciative. This is the beauty of being new, independent, nimble, flexible, leading change in the industry with a team that's truly passionate about what they do, impact, and bring to a global ecosystem. One of many priorities is to reach out to emerging nations to foster an inclusive, diverse, scholarly environment. In fact, our TMT Article Award this year is from an author from Bangladesh. Our two journals serve two sectors I believe are driving a new era of global digital health modernization, access, affordability, and choice around the world. Blockchain in Healthcare Today is the world's first peer-reviewed journal that amplifies and disseminates distributed ledger technology research and innovations in healthcare, information systems, clinical computing, and network technologies. Telehealth and Medicine Today, the gold open access international peer-reviewed journal, examines the value of telehealth and clinical automation, its use, scalable developments, and business process guidance in this evolving healthcare sector. Our team invites work that demonstrates not only novel research, but research that makes an impact, particularly the financial impact on workflows and patient care. How can technology and innovation be used to create the best patient experience at low cost, providing accessible, convenient, quality care for those in need? Sometimes answers can be found by sharing negative and failed results. In some cultures, this is not acceptable. The scientific community tends to reward success. This cycle must be broken. The scientific community, as the current reward system stands in academia, is hampering progress, clogs innovation pipelines, and can stymie innovation from early stage career researchers. Negative results are held in high esteem at Partners in Digital Health. In fact, the first Best Article Award in TMT went to a $50 million startup that went bankrupt. Failure is how the most important lessons are learned and takes the most courage to report. Failure saves time and money in a system that must curtail cost. Failure takes the most courage in one's career and must be held in a most esteemed category for reward. In what ways have we experimented with our portfolio, and have we failed? You ask if our journals are indexed, and do we have a JIF, a Journal Impact Factor? The Journal Impact Factor, which is what drives the current research assessment culture, has had an identity crisis. Current conversations around research proposes it should be assessed on its own merit rather than the journal in which it's published. If that were true, we wouldn't be chasing indexes, and you wouldn't be asking us for them. Many groups argue that focusing on journal brands intensifies competition between researchers and journals in ways that distort behavior and undermine a healthy, productive, scholarly enterprise. I take this from DORA, D-O-R-A. As we know, a journal impact factor is a poor predictor of the number of citations a paper receives. Our own BHTY, Blockchain in Healthcare Today, is a perfect example of this. It has no journal impact factor yet, but it does have an inordinate number of citations. Shifting the emphasis from journal article is highly desirable and precisely how we approach content. It's amplified on its own merits. I'm certain our rigorous peer review process has strengthened these highly cited articles in making them valuable contributions to the scientific community. The culture of hiring, promotion, and grants must change, and for this, we must encourage organizations to adopt change. This is slowly occurring, but I encourage you all to find acceptable outcomes that can be quickly adopted by all. The journals are indexed in Science Open, Index Copernicus, Unpaywall, Nebis, Google Scholar, and the PKP Metadata Harvester. We don't game the system and operate transparency. We ask member organizations and industry to do the same and reward bibliodiversity, integrity, and minimize bias, considering there are many small independent publishers like us operating and competing with legacy publishers. What do we do that's different to bring more value and trust to the international scientific community? The journals host the annual CONV2X Symposium, a leading healthcare transformation and modernization symposium. This is where the past year's article of high consequence is selected by editors-in-chief based on total views, downloads, and citations. BHTY publishes an article proof of origin, where header hash log data stamping is used to protect authors, research content, and the network is climate friendly and low to no carbon footprint. And I share that with you because I am asked, so I am sharing. The journals were first to bring the first life science research portal to a global research community through artifacts, registering original research, article provenance on the blockchain. We accept digital currency payments. This is to enhance inclusion around the globe. As we know, not all are awash in fiat currency, and some may have digital assets to apply. The Partners in Digital Health Institute features a speakers bureau where SMEs and journal editorial board members are included in appreciation for their voluntary service. We've launched a work stream to create a new business model incorporating digital currency to enhance reproducibility, sharing, and engagement for research that's published. We also have license editions, extending readership, and a university APC rate in addition to waivers. Those of us leaning into the future and already on board and maximizing across many social platforms to share and amplify truth and innovation in science. Like it or not, science needs to go social because that's where politics, the media, and the funding bags have placed it. The new school of thought encourages, appreciates, and in some cases requires amplification across social media and open access communication outlets, especially those using public grant funding. In our case, launching a new portfolio in two evolving new health era and tech sectors, the social media aspect is important to offer additional value to authors and expand evidence-based knowledge across public audiences, attracting new manuscript submissions, and expanding reach faster. Of course, there are those that absolutely will not consider a journal without being indexed and having an impact factor. This view reflects the legacy system of promotion and tenure that many are trying to change now. And what can you expect from publishers like PDH communicating science and discovery? Where are we headed in the current scientific research conversation? Machine learning and AI have the potential to change how publishers and aggregators organize content, deliver it, make recommendations to readers, connect scholars with publishers, and find peer reviewers for manuscripts, while interoperable metadata can analyze positive and negative article citations, impact discovery, sales, and usability. Tools for trust and transparency can be applied to support dissemination of research with blockchain, adding value for provenance, security, contracts, and consent. We do need more rigor and integrity in the avalanche of research submissions from Asia. This includes requiring integrity and excellence through best practice, standards, and collaborating with global scientific community in open data sharing. Language diversity, research sharing, cultural pluralism, or bibliodiversity, are all priorities to include for more published research from around the globe, including emerging markets. As you know, the PDH portfolio is one that sets trends, is forward-reaching, and followed by many. The role and impact of social media in scientific communications has been part of our strategy from the outset, knowing we could add more value to authors and their work while waiting on index application reviews that are often touted black holes with wait times and resubmissions taking anywhere from 1 to 3 years. We must change gaps in scientific dissemination that include the volume of published research, stymieing the overall pace and quality of published research. The size of scientific fields may impede the rise of new ideas. And when the number of papers published per year in scientific fields grows large, too large, citations flow disproportionately to already well-cited papers, and newly published papers become unlikely to disrupt existing work. This suggests progress of large scientific fields might be slowed. As a result, expect policy measures shifting how scientific work is produced, disseminated, consumed, and rewarded to push fields into new areas of study. This is exactly what we experienced when we launched BH2I. We created the niche and provided the credibility and validation for it to grow and flourish as a new field in science and technology for healthcare. Bias in gender, career stage, and geography must be eradicated in science and scientific dissemination. May I suggest this includes new, female-owned, independent publishing companies. We must come to terms with true innovation and creativity versus publishing in top-tier journals for more profit and production iterations. Many novel innovations are going to second-tier and specialized journals, and we experience this effect with our journals. Glenn Bagley stated, sloppy science costs the US $28 billion a year in lost opportunity and non-reproducibility. We must give money to innovative scientists to keep the US at the forefront of discovery and innovation, a hot topic of late with all the spigots open and flowing with grant opportunities. The social impact of research is an increasing priority within the scientific community, particularly since it enables sharing and opens up new venues for citizens to interact with work. Scientists must include social impact and communication strategies for their work to reach different ages, genders, cultural backgrounds, and education levels. More publication is not enough. To generate impact, you must leverage all media outlets available. This is not a predatory practice. Demonstrating the impact of research outside academia has become a standard requirement for many research funders looking for return on research investments. Cause and effect equates to impact. Launching and leaving your research in print or online no longer works. Look for publishers like PDH that can assist your efforts. You may already know telemedicine is set to grow 18% through 2024, and blockchain in healthcare is estimated to grow at a compound annual growth rate of 35%. Since our portfolio both reflects and sets trends in the marketplace, allow me to share what I believe topical trends and current issues are in the market with you today. For several years, I've advised focusing on the home care market, continuum of care, and care transitions. The emergence of this market has arrived, and we've planned several sessions here at CONV2X for you. With aging populations and looming healthcare worker shortages, virtual care will build resilience into the US health system. You may not be aware, the first worldwide telehealth hospital was launched in Israel earlier this year. Where is the US and its leadership in leading innovation in this sector? In September, the White House released the Office of Management and Budget draft for a federal strategy to move the US into zero trust architecture, which will enhance security across federal agencies. Many businesses have already adopted this strategy. It follows the executive order on improving the nation's cybersecurity. If you've been hacked recently, you understand the urgency. We may also have too much tech in the market, similar to too much research. It blocks true innovation that can change the trajectory of the market. I ask you to find solutions built around the needs of patients, low cost, and solutions for multiple user experiences that are interoperable and secure. The metaverse, a fully realized digital world with 3D virtual spaces creating a perceived virtual holographic experience. And this includes digital twins, a virtual simulation that operates as a real-time digital counterpart to that of the physical. The metaverse is coming to a household near you soon. Diversity and inclusion presents new market opportunity and discovery for clinical trials, startups, apps, payment models, cross-border collaborations, market investment, and more. COVID taught us there are significant differences, and using data collected from white males does not inform population health. There are sexual, cultural, age, and geographic diversities to consider as well. The cash economy in healthcare is one on the rise. It's what I call retail health revolution. Employers have already begun to give their employees cash instead of health insurance. This is a business model of care where consumers pay cash for drugs and services that are cheaper than those covered through insurance. I've been doing this for years. Hims and Hers uses a cash-based model successfully, and providers love this one because they don't have to deal with system bureaucracies. Price transparencies in a $1 trillion market is a hot potato, and someone has to champion it. The January 1 CMS rule required most health insurance market plans to make hospital pricing transparent for patients to compare costs of care. It required posting negotiated rates for 300 items and services. And the result was 5.6% of hospitals are compliant, when 85% of Americans believe cost-cutting and improving quality through transparency should be a priority. One insurer posted these items on a site with no SEO, so Google search couldn't find it. Integrity matters to consumers, and if you're looking for loyalty, that's not the way to get it. Site-neutral payments. CMS is using site-neutral payments to level the playing ground between what physician offices and hospital outpatient departments are paid for clinical visits. A report released found that this would save the US $350 billion over the next decade Stay tuned for more on this one. Ambient AI uses real-time human perception technology where physical environments interact intelligently with people, where technology can anticipate and respond to people's needs, customize and forecast behaviors across the continuum of care. Environments and structures we build today should include this technology. The life sciences community, pharma, clinical trials, researchers, and others have had their heads down for some time and just picking them up now. BHTY recently published an article submitted from Boehringer Ingelheim on informed consent, process, and patient engagement in a clinical trial. We welcome more from the pharma industry like this, and soon. Cryptography and applying quantum mechanics for uncrackable code for two parties to interact securely. The US is teetering on losing its competitive advantage and may have already. Get behind this one now. Although low cost, fast, secure data interoperability is on most agendas, healthcare for more is not. 12 states still have not expanded Medicaid. I implore you to take politics out of healthcare. Remote patient monitoring, managing care in real time, including scheduling and drug adherence. CMS is amplifying telehealth and RPM with new CPT codes. The inclusion of new remote therapeutic monitoring codes in the 2022 physician fee schedule signals the transformation of digital health policy in response to COVID-19. Let's ensure these stay permanent. Wielding long-term consumer brand loyalty must be understood by our marketplace. Changing doctors with every new health plan does not endear loyalty. Overall satisfaction with all telehealth services, meaning both direct to consumer and payer sponsored, fell from last year. Responded indicated the most glaring points of discontent were limiting services, lack of cost awareness, confusing technology, and a lack of information about providers. It's time to understand transparency rules. The FHIR network is catching fire. We'll see more standardized interoperable data platforms make their way to market and facilitate digital health tools built on FHIR. And finally, blockchain will improve how the public interacts with government services and will have broad economic and social implications. Global health passes and interoperable permissioned global networks are examples. In closing, we're building quite an exciting blueprint for a new digital health era and care. In the past, I've asked you to ponder what role and purpose your businesses play in impacting the social contract and how consumer and provider empowerment might bring change to your business models. Did we really need a pandemic and 18% GDP to force that change? Now that the cost of care is center screen, I encourage you again to explore the significance of disintermediation, universal basic income, and a one-party payer system. I am quite sure you will find solutions and workarounds. There is no room in our market or nation for complacency. The US healthcare industry is poised to adopt new frameworks and plans to blaze rapid success. Today at ConV2X, we share knowledge from around the world, advancing health policy, virtual care, blockchain in healthcare, and frontier tech in a revolution of borderless interoperability led by consumers, activists, and pioneers challenging market integrity and sensibilities. Like our portfolio model, let's build trust through truth. Give the best of yourselves today. Thank you so much for joining us at CONV2X 2021. Let's begin our day.